Good afternoon. My name's Peter Page. I'm the Hospital General Director here at AMCH, and I'm joined today for the video with Dorothy Urschel, the CEO from Columbia Memorial. Welcome, Dorothy.
Thank you. Happy to be here, Peter. Thanks.
Excited to get the video kicked off?
Absolutely. I love these videos.
It's always worthwhile.
And I thought I was sitting with Dr. McKenna today, so it was a little bit of a disappointment for me.
That's understandable. I hear that a lot.
Kidding.
I just keep going forward. We want to start off with some of the latest news that some of you may have heard about coming out from the New York State Department of Health. And it really relates to the vaccine mandate for COVID for regulated healthcare facilities, employees. And recently we found out that the Department of Health is looking at going through the process of repealing the mandate. It's still very fresh news. There's still a lot to be decided. A lot of information will be coming forward. We've taken the information. We're meeting with our specialists here at AMCH and talking across the system about what our plan should be. We just want to make sure that it's well vetted and incorporates the expertise that we have available to us. And we always want to concentrate on promoting whatever the safest option is for not just our staff, but also for our patients. And I don't know, Dorothy, if you want to add anything.
I'll just add, I really enjoy the system approach. I think it's very important to work as a system in lockstep, especially with these items. And there are other implications to it, especially given, the employees that we lost over time and bringing those employees back. So waiting for, I think this will be a good experience for us as leadership and move this forward as best as we can.
Yeah, and it's a good time. The whole
I completely agree.
The whole COVID
it's really sort of
has
changed.
changed.
There's such great immunity out there at this point too. So
great. So more to come on that. We will keep everyone updated, and you probably saw the messages that came out earlier today as well. The next subject I wanted to bring up actually relates to research at our college. Very exciting news. It's actually a joint collaborative between RPI and Albany Medical College, really allowing us to get outside our four walls and really form collaborative models with other organizations in the capital region. We were fortunate enough to be awarded a $3.3 million grant from the National Cancer Institute, a really cool project, and it's really utilizing artificial intelligence to improve targeted drug therapy for certain types of breast cancer patients. I did want to recognize two individuals, one from Albany Medical College, Margarito Barossa, Professor of Molecular and Cellular Physiology and Director of Imaging Core Facilities here at the college, and then Xavier Intez Rensselaer, Professor of Biomedical Engineering and Co-Director of the Center for Modeling, Simulation, and Imaging in Medicine. Two great people that are taking on the lead in this project. Obviously, I had to write down their titles because they're rather extensive, but research is really one of those areas that separates us from a lot of other people in the capital region. Really exciting to be able to recognize that achievement.
You certainly stand apart, there's no question. Congratulations.
Thank you. Next topic will be the Workforce Challenge. As many of you know, and many participated, last Thursday the Workforce Challenge took place in downtown Albany. It was a Thursday evening. The weather was nice. We had over 360 participants. And Steve Jones, one of the nurse practitioners from our children's hospital, actually has been the team captain since 1986.
Oh my gosh, that's great. Is he a runner?
I don't know if he ran or walked this year, but
He's a big runner. Okay.
I guess he did run.
Someone's nodding appropriately behind the scenes.
I did not run. I did not walk.
You didn't?
It was
Did you wear the shirt?
It was 3.5 miles.
Okay, we've got to get Peter out.
Yeah. You're asking me a lot of tough questions.
Well, if I can dovetail on that, Columbia Memorial Health had our first run for the health of it. And we were very excited, and we had just a little over 100, but that was our first run in many, many years. Actually, I don't even know if they ever had one. And they wanted again in the fall. It was so well attended, a lot of families, dogs. It was great, and a lot of fun.
Yeah, it's really great seeing our folks get out there.
Yeah.
With the Workforce Challenge, we had representatives from all four hospitals.
Yeah.
And we were the largest nonprofit organization as far as number of participants in the challenge.
That's fantastic. That's really great.
It's really
Again,
great
congratulations.
Stuff. Now, I heard you've got some excitement coming up at
We do, we do. Next Saturday, June 3rd, we're holding our annual gala. Gosh, I wish I could remember which one it was. I believe it's the 35th. The hospital is 130 years old this year, and we are holding the gala in honor for Jay Cahalan, our former CEO. So a lot of great, we have our original founders of our foundation attending. And again, I think it'll be a really great time, and we can honor him. Jay worked there for 28 years.
Wow.
18 years as the Chief Operating Officer and 10 years as the CEO. And I was privileged to ascend there after him. So it's been a nice experience since, and he's been supportive the entire time. So we'll have a lot of fun, and I know that Matt Markin will be attending, so it will be even more fun that he is there.
Yeah, it's I didn't have an opportunity to work a lot with Jay.
He's
but,
great.
You know,
he's a nice guy.
He
He's
was
a really good
great to work with.
Yes.
And the transition's been great. So congratulations.
Thank you.
The ease of the transition. You've moved into the role.
Thank you so much. Well, your support is welcome, and the support of the system. Honestly, Dennis and others, Fran, have been very supportive of me. So it's been a nice experience.
And you've got a lot of work going on with Centers of Excellence.
We do, we do. So we're really reaching out to the communities that we serve. So just as a background, Columbia and Greene County, we serve over 100,000 residents at CMH. It's more of an outpatient site. 80% of what we do is outpatient services, as you know. And our inpatient, our hospital, again, 130-year-old hospital, is a 192-bed certified hospital, but we only serve about 100 inpatients on a daily basis. We've seen that the majority of the patients we serve are moving into the ambulatory sites. So again, serving the communities is so important. Jay, just to reflect back on him, his work was really expanding the primary care footprint. And so one of our areas in terms of centers of excellence is primary care. The focus, and I'll go through each of the centers, but really to think about it as a service line or really an approach to really develop a center from an excellence, a performance excellence, and a quality performance perspective. And what that means is delivering care, having it be patient-focused and centered at all times, devising and developing performance metrics at that center level, and doing that with the physicians and the providers at the center. So instead of us telling the orthopedic surgeons how they should be providing care, they're going to tell us how to provide care. And we sit, we listen to them, and on a monthly basis, we develop some subgroups from that main group to really go out and provide the service that we need to provide, improve patient access, throughput. So for example, I was sharing earlier, you know, we would, again, the service line for the Center of Excellence for Orthopedics, we would sit down with the chief of the service, the orthopedic surgeons, the folks from the operating room, the folks from the service itself, in the post-op arena, the pre-op arena, and just say, where do we do things really well? Where can we improve things? And really start the path in terms of performance improvement. Again, monitoring those metrics and monitoring the quality. The areas that we're focusing on are our breast centers. So we're working with Albany Med Health System on breast center accreditation. And Dr. Raquel Astorga is our key physician. We are working, we have our breast navigator as well, and we have an individual from Albany Med who's assisting us with the accreditation itself, which is fantastic because we don't have plastic surgery on site, so we utilize Albany Med's plastic surgeons, and we do the basic breast work there, and core biopsies, mammography, etc. So again, these procedural areas are just so important to grow our services and to serve our communities. The other is endoscopy, so a focus on GI and focusing on the procedural volume through throughput in the endoscopy suites, and then sending the advanced gastroenterology work to Albany Med. So it works perfectly from a clinical integration perspective. The other is primary care, as I stated earlier, and we also have our pain management department, so focusing on that, as well as women's health. And our focus of the gala this year in terms of raising funds is our women's health department. So we're refurbishing the area, we're growing that service. We recruited a resident from Albany Med Health System, so happy to have her join. And again, looking forward to just, again, continuing to manage and support our communities.
And it's a lot of fun. We obviously are you know, joined at the hip. You know, we're really trying to work together across the system. And,
Yes.
Obviously between us for the Southern Strategy and really trying to support your
are.
initiatives,
Yeah.
especially on the outpatient front. So really exciting opportunities for us to move forward.
Thanks, Peter. I agree. Thanks.
I did want to mention the Double H Ranch. There was a big cleanup event that a lot of staff participated in, really to get the ranch ready for the summer. They do amazing work out at that ranch, and it's very close and personal to a lot of people here at AMCH and across the system.
It's great work.
And
great work down there.
actually, we do have a number of people who also are clinical volunteers for the summer.
That's great.
Which is really a testament to some of the people that work here. As many of you know, I'm an emergency medicine physician, so this is an exciting week. It is Emergency Medical Services Week. You know, we owe so much to our pre-hospital providers. They do such an amazing job in such challenging situations, and they do it so well.
They do.
We have so much skill out in the pre-hospital world that it's really appropriate that we have a week to recognize them.
We're doing a number of functions in Greene and Columbia County as well, so I agree with you wholeheartedly. They do great work.
So when you see an EMS provider this week, please reach out to them and thank them for their efforts. I do have another kind of announcement. Next week is the Red Cross Blood Drive. It's going to be May 30th, 7A to 7P. F309, the boardroom here, tends to get a lot of activity, very well supported. Obviously, we know how important.
Yeah, especially being a level 1 trauma center, you need that. That's
heading
great.
into the summer and these
Correct.
holiday weekends, we anticipate it being busy.
Yeah.
The last thing I had to talk about, one big announcement, we have named the new Chief Nursing Officer for Albany Medical Center Hospital. It is a gentleman by the name of Kevin Zhang. He's coming from California, from the Kaiser Permanente system, and he's the Director of Patient Care Services at Santa Clara Medical Center. And has a lot of expertise in strategy and operations, culture, really getting alignment. We think he'll be a nice fit into the organization. I did want to recognize Mary Alice Cullen, who's been serving in the interim role. She's going to continue in the interim role until Kevin arrives. She's also going to stay on in a senior nursing leadership position.
That's great news.
As we continue to work with the transition of Kevin on board. But very excited to get that search done and get that announcement out and move forward from there.
Congratulations.
Thank you.
That's great.
With that being said, big holiday weekend coming up. You know, personal thanks to everyone who's working this weekend.
Yes.
It tends to be a busy weekend, so thank you for all you do. And as Dr. McKenna reminds us, always take care of yourself as we continue to work as hard as we are currently.
Be safe out there this weekend. Thank you.